Hi, this is Bob Scully, and welcome to another edition of the World Show, Entrepreneurs, the Walter Series. Ever since the historic breakup of AT&T, which seems like it was centuries ago, things are going so fast now, but it was actually in the Reagan administration. It's not that long ago, but ever since that historic fragmentation of AT&T into the 11 units, the so-called baby bells, telcos have changed, and for the better. They've become extremely dynamic and innovative. They have to. Competition is a lot warmer than it used to be, and especially with the arrival of the Googles and Amazons of the world, the pace has even quickened. And so telcos are proposing to take care of a lot of your needs, for instance, investment, communications, and now also health. As surprising as it might sound, up here in Canada, TELUS, a major telco, is involved in health in a big way. And the entrepreneur spearheading that is Paul Lepage, who's doing a great job, and his children had something to do with it. Here he is. Paul Lepage, there's often a family angle in entrepreneurship, but generally it's succession that brings it out. In your case, it's different. It's much more moving in a way and more important because it concerns your kids. I'll let you tell the story.
So, well, both of my kids, my son, Carl, who's now 23, my daughter, Claudie, who's 21, are type 1 diabetics, and have been sort of type 1 diabetics for 18 years. And
they were diagnosed at 3 and 5, I think.
Yeah, 3 and 5. And so the life of a type 1 diabetic consists of, taking insulin, 4 or 5 times a day. So insulin shots 4 or 5 times a day. Checking your blood sugar levels every 3 to 4 hours. And this is 7/24, 365 days a year.
And for a kid in the school,
vacation, no holidays.
And for a kid in the schoolyard, it really must not be easy. I mean, they have to walk around with that syringe in their pocket and so on.
Yeah, so there's a bit of a stigma there, but I think my kids got over that part, quite easily. I mean, for the parents, what it means is it changes your life, right? All of a sudden, you have to become an expert in sugar. Yeah. Counting carbs, and you become an expert also in managing insulin. Like there's fast-acting insulin, slow-acting insulin. And so you're constantly looking at diet, what they're eating, the amount of exercise that they're doing. Today, I mean, obviously it's changed. My kids are now managing their own disease.
And I don't know if I read the research correctly or too quickly, but what I took away from it is that you were basically, by training and profession, an IT guy with a strong interest in health, and you merged the two. Through IT, you came to healthcare. Yeah.
So, I mean, the reality is I'm personally fascinated with healthcare. Family. My father was a physician, and I have 2 brothers that are doctors. So, sort of, there was. I guess I'm the one that missed my calling. And
yet not.
Yeah, and yet not. So, I mean, I'm fascinated with what I think information technology can bring to healthcare. And, if we look over time, like what's really interesting to me is go back to the 30s. We discovered penicillin in 1928, I think it is. And, we've gone from a world where it was a focus on infectious diseases to today, so life expectancy was 60 years, to today where it's 80 years. So what's happened is there's been a complete shift in where the focus has to be in healthcare. So all of a sudden, people are living longer. People are living with multiple chronic diseases.
Yeah, 40% of the population. I got that out of the research as well. I didn't realize it. It's enormous.
Yeah, 40% of the population has a chronic disease. So it's, add up mental health, type 2 diabetes, which is a big driver, congestive heart failure, anything to do with pulmonary diseases, cancer.
Arthritis.
They're up there. And what's happening is because people are living longer, they're now living more and more with chronic diseases. In some cases, multiple chronic diseases. So healthcare has to focus less on acute care and more focus on the primary care, so the care that's given by doctors in clinics and closer to the population.
Well, we'll get to TELUS Health in a moment, but I think there's one other intermediary stage, so to speak, that you went through with a company called Emr Solutions that eventually got sold, but that is where you were a pioneer. This is where you figured out all the possibilities of uniting IT and healthcare at a time when there was a lot of skepticism. People thought it was science fiction. So what did Emr Solutions do?
So Emr Solutions was a company that was focused on two aspects of healthcare, the clinical aspects and also resource management. So the staffing in healthcare, because there's a lot of people that work in healthcare. Sure. So payroll, financial solutions, scheduling solutions, as well as clinical solutions, so electronic health records and things of that nature. And I came to Emr Solution. It was interesting. I was working for a company called InfoSpace out of Seattle, Bellevue, Washington, and my last year at InfoSpace, we were doing acquisitions in the UK. We were doing acquisitions in the US. I'd done 188 flights in 1 year, and I said, you know what, I got to do something a little bit different with my life. So there was this opportunity at Emr Solutions, and joined the company as Chief Operating Officer, and we had the opportunity of turning that company around, refocusing the company, and eventually splitting it into two divisions and selling.
As the research says, you sold yourself out of a job.
I sold myself out of a job, but I got hooked on healthcare. I got hooked on the potential. To me, healthcare is like the, let's call it the final frontier. Right? It's the area where health IT has not, we haven't had the same impact in healthcare as we've had in other service industries. So if you think of other service industries and where we're at today in the other service industries and the power that's given to the consumer. So that shift in the balance of power that's taken place in other service industries because of social media, because of, if you're in the travel industry, TripAdvisor plays a big role on where you stand in the pecking order. And that hasn't come yet to healthcare. It's starting to happen. So to me, what's fascinating is the ability to apply health IT to improve our healthcare system.
And what's particularly original here with TELUS is that, after all, it's a baby bell, to use the American term, like Pactel or New York Telephone or New England Telephone. That's what it does. It services as a telco regionally and nationally. And when those types of companies go for content, which they do, it's usually very conventional content. It's cable, it's programming, it's data. It's the kind of stuff they understand to begin with. But TELUS made the very original decision of treating health as content. That stunned a lot of people. How did that decision get made?
So the decision was made by Darren Entwistle, who was then CEO, who's now our executive chair, who saw the opportunity to focus in healthcare and to really bring the type of solutions that are required in healthcare. Because when you really look at healthcare, you think of the challenges that we're seeing today. A lot of the challenges are around how do we make sure that the information is available to healthcare providers. So how do we connect healthcare providers to that information? And then how do we make sure that those healthcare providers can collaborate amongst each other, share information? And then how do you take that information, analyze that information to determine better health outcomes? And Darren had the vision at that point in time to say, look, this is going to be our content play, and this is going to combine what we do from a wireless and wireline perspective, leverage the power of the internet, but in a vertical market that really needs to bridge time and distance.
And with those lovely telco deep pockets to develop it, because let's face it, it's a very worthy goal, but also a very costly one. It's a development play as well.
Yeah, so I mean, over the years, with various acquisitions, TELUS has spent over $1.5 billion in building the healthcare business. And today we have a business that's on a great growth curve. We're growing at about 10% revenues and 10% EBITDA on an annual basis. And our objective is to take our healthcare business to $1 billion.
And there's a kind of there's a sweet irony in there, because when the other telcos have wanted to branch out and do something that might be, fun oriented or retail oriented, again they went for the obvious. They bought a sports team or a brewery or Lord knows what, and you took something very serious, very important, healthcare. And again, you left your colleagues in the dust. But I assume, however, that in this field you are competing with those IT companies that are already occupying the healthcare sector.
It's an environment of co-opetition. So on many projects we will partner with other IT service providers, and we'll partner on some larger deals. But our position is really one of bringing these solutions to market, and how do we bring distinctive solutions to market in various markets that make up that whole sort of healthcare ecosystem. So you can think in healthcare there's the payers.
Yeah.
So there's public payers,
Insurance.
private payers, the insurers. There's the health authorities, so the provincial governments that are focused on improving healthcare for their citizens. And then there's the providers, so pharmacists, physicians, extended healthcare providers. So what we're doing is building an ecosystem of solutions that cover those three markets, with this focus on driving reach to get to as many as possible, driving harder at the collaboration amongst the healthcare providers, and driving at health outcomes.
Entrepreneurially speaking, who's the client here? What's the exact business model? When your sales force comes knocking and asking to provide a service, as you've just described, who's the target?
So, ultimately, the client
patient,
is
I guess.
the patient.
Yeah.
It always ends up being the patient, and that's one of the realities that healthcare has to change. It has to go from this sort of siloed view of the world that we've had to putting the patient at the center of all these interactions. But what we've done is we've structured TELUS Health around business units, around payers, providers, and sort of enterprise or health authorities.
So you service them all.
And so we service them all. And we build this ecosystem of solutions that meets the requirements of the various players.
Earlier, I was mentioning the skepticism that existed a few years ago concerning all this, and people were saying, yeah, one day it'll all be on a tiny chip, but we're far from that. It isn't done yet. It may not even be doable. I think if you canvassed people today, and I'm sure you have, we'd find that that skepticism is taken care of. It is doable. It's proven that it can be done. It's being done. But there's something else. Now the skepticism is it's a mess. Hospitals are losing records. The IT systems don't talk to each other. I'm sure you probably have to reassure people about that.
Yeah. So my view, Bob, is that the glass is half full. Okay.
That's a good view.
And the reality is that if we look at, for example, the penetration of electronic medical records in Canada, we've gone in the last couple of years where we had 60% in 2013 of physicians using an electronic medical record to 75% of physicians using an electronic medical record, with certain provinces like Alberta, BC, and Ontario, north of 80%. We still have a catch-up to do compared to some of the Scandinavian countries or the UK, where those penetration rates are 90-95%, but we're closing the gap there. So from my perspective, the first key thing is to make sure that the areas where there's low-hanging fruit in terms of where we can get physicians to use technology, we're closing that gap. The other, I think, key driver is the change in the patient's attitude towards healthcare. I think as Canadians, as patients, we're very patient in the healthcare system, but that's changing, and we're seeing, frankly, more and more patients want to play a more active role in managing their health. And the health authorities have to capitalize on that because, if you think of other service industries, why did we introduce, portals that allowed people to self-help? One is because people wanted to do that. People wanted to book their own vacations, but also because it was cheaper to do that.
Course, yeah.
So I think what's happening is as people get more and more educated about their health and they have more and more information thanks to the web, they're going to want to play a more active role in managing their health care. And as people live longer and they're going to be living with chronic diseases, they want to be able to take charge. So I think that's happening. So my view is we're seeing the connectivity of these various systems come together. The initial estimates that called for a single medical record for all Canadians by 2010 have been missed. I mean, obviously. I'm cautiously optimistic that by 2020 that's going to be the reality, and I think we're going to start seeing this.
Will it be portable? In other words, the citizen could bring his file from one end of the country to the other, from one hospital system to another. I guess that would be the goal.
That's the goal. I mean, the UK has NHS, has so the National Health System in the UK has made that a goal, that by 2020, all patients will have access to their personal health information. And clearly, from our perspective, I mean, obviously that's going to be sitting on this device.
Yeah, of course. I was going to say, yes. It'll be.
We want people to be using.
It'll have the logo.
Yeah.
Right. And I'm wondering if it won't move at some point to a retail model, because right now all your clients are institutional. They're hospitals, governments, insurers. I think as this gets better and better, more perfected, you'll be tempted to do a bit of an iPhone revolution on your own and issue a TELUS health card. I mean, that's what the whole thing leads to in a way.
I think the notion of wellness and, there's a whole spectrum in healthcare. So you kind of go from illness all the way to wellness. I think the wellness aspects will end up being consumer driven for the most part, because I think we all have, our own personas, our own realities. Either you're into biking, you're into running, you're into different things. My view is that as a Canadian, I'm proud of our universal healthcare system. So I want our universal healthcare system to succeed. So I think there's that reality. But I think what we're going to see, though, is the ability for us as consumers to combine what's in the public healthcare system with elements that are in private healthcare today. So what you're doing with pharmacies, what you're doing with your insurers, how you manage your wellness. And you're going to be able to combine those aspects and sort of manage that as on a personal health record. So I definitely see that.
Made to measure, that's what you're describing in a way. Made to measure is good in this area, obviously, and so is portability. But there's a third value, I'm sure, that people are thinking of as they listen to us. It must be on their minds, and it's confidentiality. And it runs counter to the other two, because the other values want to make information very fluid, very accessible, put it into circulation, make sure everybody has access so they can treat the patient. But for the patient, these are secrets. These are very personal things, far more precious than their bank records and so on. And so you have to worry about that. They must be thinking, by God, TELUS and all these institutions will know everything about me.
So the reality to me on this is, yes, all systems have to be reliable, privacy has to be maintained, high levels of security. And as a patient, as a citizen, I want to be able to toggle who has access to what information, and I think that's key. But that question has to be asked in specific contexts. So, for example, if I show up in an emergency, I want you to have full access to all of my relevant healthcare information. And I think what's happening is that the like mobile devices are solutions where and software as a service has the ability to make sure that nothing actually sits on the device. So we have a mobile EMR solution, for example, that we've rolled out to a series of our physicians. And what it allows them to do is basically access their EMR and access patient record information, access schedule. And the uptake of this solution has been phenomenal. Like we've had, 33% of our physicians adopt the solution right away, download the application off of, the iPhone App Store and start using the application with no training. I mean, very little training. So but what's happening here is this is a solution where they're accessing the information. None of the information resides on the iPhone. It all is going back into the cloud. So
But that cloud, the existence of that cloud, that's precisely what will worry people. Because obviously, as you have pointed out, in emergency cases, convenience and efficiency will always trump confidentiality. If you're in the ambulance having a heart attack, you want the doctor to have all the knowledge about you that's needed and have it immediately. But if there is a cloud containing everything, we can imagine one day some hacker thinks it's a good joke to publish everybody's medical records, just like that. So you must worry about that. I assume you have a group working on that point, on secrecy.
So obviously we spend a lot of time and energy on security of health information, denominalization of that information so that even if they access the database, that information is somewhat protected. And the reality is we take that threat very, very seriously. The challenge here is to your point, what you mentioned before, it's the benefits. The benefits outweigh, for most part, the risks. We don't want to take those risks lightly, but we need to focus on making sure that the proper information is available. Because right now, as a citizen, it's not that your information, there's no risk. I mean, your information sits in patient records today that are in that are in files.
It's already accessible,
or they're sitting in servers that could be hacked.
True.
So there's risks there, and so I think we have to manage those risks, and we constantly have to manage those risks to make sure that the benefits outweigh the risk. Clearly.
And are you going to have the very first TELUS health card? I can imagine it'll be issued with your name on it and 001 like a license plate in a country.
I think the health card is going to be embedded in the device. No different than today. We're launching mobile payment off of the phone.
Yeah, of course. Yeah.
So everything I think will be that chip that sits on that card will be sitting in the phone.
And it's not unlikely to think that TELUS Health will eventually, perhaps, become the biggest business unit at TELUS, the way things are going.
It'll be an important vertical. It always will be an important vertical. What's interesting is that the solutions that you're rolling out in TELUS Health are the same solutions that are going to be used in other market verticals. So think of payment, mobile payment. Think of big data. The ability to look at those databases and exploit the data to be able to provide even more information back to providers so that physicians, pharmacists, they can better treat their patients. Think of software as a service, we've been doing software as a service for 20 years now in healthcare. So those markets, Internet of Things, so the ability that everything's going to be connected. Not only your home devices are going to be connected, but
everything.
And a lot of our solutions today, Bob, we roll out solutions like home health monitoring solutions. And a home health monitoring solution is you discharge a patient who has a chronic disease, and you give them a care plan and a tablet, and they head home and they start using that tablet, and they'll use a pressure cuff, they'll weigh themselves, they'll do what they need to. That information is all fed back into the care plan and back to the care team.
Sounds great.
These are applications of Internet of Things.
Well, Paul, one day, if I need an ambulance, I know what I'm doing. I'm going to call 911, and I'm going to say, I know Paul Lepage personally, so come on over here and take me to the emergency.
Thank you. Thank you.
Paul Lepage was our guest this week on Entrepreneurs, the Walter series of The World Show. I'm Bob Scully. Have a great week. Thanks.